So in this video, I will be sharing the distinctive features of both of these conditions. And I hope after watching this, you will be able to better differentiate between these two. Well, first of all, let me start with that there's some debate among doctors about whether MS should be considered as an autoimmune disease, because researchers still haven't found the MS substance that would trigger the body's immune system, or specifically, they haven't found the antigen. Well, instead, MS is sometimes referred to as an immune-mediated condition rather than an autoimmune disease. Well, first of all, let us look at the disease mechanism of both of these. Well, in MS, you can link the MS with myelin sheath. Well, our immune system basically attacks the myelin sheath of neurons. Now, this is the protective layer around the nerve fibers, and it is responsible for the smooth flow of the nerve impulses between our body and the brain. So the damage to these myelin sheath will affect the transmittance of nerve impulses. And just like a damage to the insulation of an electric wire affects the normal flow of current, this will obviously affect the normal flow of nerve impulses. Now, sclerosis from multiple sclerosis means hardening of tissue and can refer to this damage of the myelin sheath. So what will happen? This will hinder the normal functioning of our body and can often cause muscle weakness or spasticity or memory loss and all the other symptoms that we're going to discuss ahead. And obviously, we will also observe chronic inflammation, gliosis or scarring, and neuronal loss. Now, potential mechanisms include cross-reactivity with CNS myelin anti-antigens that are triggering an already expanded autoreactive immune repertoire, or a self-limited infection of the brain that releases myelin antigens. So in SLE, on the opposite spectrum, now in addition to the nervous system, the skin, joints, kidneys, heart, or even our lungs may be affected by the immune cells, or they might be attacked by the immune cells. And SLE is an autoimmune disease and it progresses at different stages. So let's look at what happens at each stage. Now, SLE can progress in 5 stages. In stage 1, this is the immune insufficiency stage, in which there is lack of immune regulation by the body. Now, stage 2 is the hyperaction stage, in which the self-reactive T and B cells are activated. Now, stage 3 is the invasion of tissues by the hyperactive T and B cells, and autoantibodies and immune complexes form locally and systematically. Now, stage 4 is where the disease is in active state. Inflammation of tissues will be caused here. And in stage 5, there is organ destruction as a result of this inflammation, fibrosis, and progress to the end stage. So what is happening in MS? The myelin sheath is mainly affected, and the symptoms we observe in MS are a result of that. And in SLE, multiple organs are affected and attacked by the immune cells in our body. Now, if we talk about the clinical presentations of both of these diseases, well, quite a few symptoms are overlapping since our nervous system is affected in both. So we will observe neurological symptoms, including problems with memory, fatigue, or even pain that will be observed all over our body. Now, in general, a person with MS is more likely to experience these neurological symptoms, such as numbness, blurred vision, or even problems or difficulty balancing or problems with movement. Now, a person with lupus tends to have symptoms such as like I told you, rashes on their face and headaches, and they may also experience cognitive or even personality changes. Now, the symptoms associated with MS can be memorized by the word actives. Now, this could be said as something opposite of what you would observe in MS, since you are losing your muscle ability to move your muscles. So, this is you can memorize this mnemonic as an opposite of what you would experience during in an MS patient. So, A starts with anxiety, C stands for coordination problem, which could result in numbness or difficulty balancing, T for tinnitus, I for incontinence, which are bladder or bowel problems, V for vision loss or blurred vision, E for electric shocks when moving neck, and S for slurred speech. Now, symptoms that you would notice in lupus patients can be remembered through a mnemonic, which is rashes, because they have a red rash on their face. So all these symptoms can be remembered through this mnemonic, and each of the letters of this rashes will stand for a different set of symptoms, which are R for renal disease, A for arthritis, S for skin problems, which is the butterfly shaped skin rash that I keep on talking about, and also sun sensitivity. And H for hematological problems, which are anemia, thrombocytopenia, and leukopenia. E for epileptic seizures, and S for serositis, that is the inflammation of the lining of serous tissues, including pleuritis and pericarditis. Now, as we already discussed, that SLE affects different organs, so its symptoms are way more generalized. While MS, you will notice that their symptoms are more related to the nervous system. Now, if we talk about the diagnosis of both of these diseases, they are mostly symptom-based. Now, first of all, a doctor may employ different blood tests to weed out other diseases or for differential diagnosis of other diseases. And then in the case of lupus, we will go for different brain scans, specifically MRI, to check for lesions in the CNS or central nervous system or the brain. While a spinal tap exam and evoked potential test may be used to check electrical signals in your nerves. When we will do that? We will do that if the patient is suspected of MS. And another test, which is antiphospholipid antibody test, also called lupus anticoagulant, can be used to distinguish the two, because it increases the ability of the blood to clot in lupus patients specifically. While another test, I know we're talking about so many tests right now, but this test, which is called anti-nuclear antibody test or ANA test, may be found positive in both, but it is quite less common in MS patients and quite common in SLE patients. Now, if we talk about the management of both of these diseases, they just like the diagnosis, the management is also symptom-based. And they mostly involve lifestyle changes, since these patients are sometimes unable to perform their own tasks, especially if they lose their muscle activity, and may happen during neuronal loss. Now, if we talk about MS, the most common medications that are used to elevate the MS symptoms include the 3 I's, which are interferons, immunosuppressant drugs, and immunomodulators. Now, if you talk about lupus or the drugs or treatments that are used to treat lupus, you can memorize it by the mnemonic NSAID. So the N in the NSAID actually stands for the NSAID drugs, which are non-steroidal anti-inflammatory drugs. So S will stand for steroids, A for anti-malarial drugs, I for immunosuppressants. We also administered immunosuppressants in the case of MS. And lastly, D for DMARDs, which are disease-modifying anti-rheumatic drugs. Now this brings us to the end of this video. I gave you a little overview about the differences between MS and SLE. We considered their mechanism of action, their clinical features, their differential diagnosis, and the different management techniques that we use, or different medications that we may employ in the case of MS and SLE. So I hope you learned something new. So for more quick videos like this, stay tuned on sqadia.com.